So, in this video, I'll tackle this quality scenario, which is seen a lot in practice and it comes in the exams of histopathology, cytopathology in general. So, we have a 61-year-old male who had a prostatic biopsy that is positive for acinar adenocarcinoma. Radical prostatectomy was performed and it is negative for malignancy. What would your next step be? It can be such a scenario can be designed with so many organs. The idea is that you had a cancer and it vanished in the resection. It was there in the biopsy and it vanished in the resection. So what would you do? The first thing, you have to match the biopsy and prostatectomy specimens. You have to make sure that they belong to the same patient. Sometimes mix up happens. Sometimes when you see the cancer in the biopsy, it might belong to another patient and other than the one that you got the prostatectomy for. So you have to match. If there is an issue, then you would go back to the specimens received within the same day. You check for mix-ups between the specimens. Maybe there were two prostate biopsies. One is positive, one is negative, and the patients got mixed up. So that's a total different dilemma that I will not tackle here. Then your next step is you have to check if the patient had any treatment, any hormonal treatment, radiotherapy, anything that might uh, cause changes to the tumor and results in different morphology than the biopsy that was diagnosed. Then you have to review the biopsy, preferably with an unbiased colleague, to find out if it truly was a cancer, a prostatic adenocarcinoma, prostatic acinar carcinoma or not, actually. So the next step is to check the tumor laterality. And then, for example, let's say the tumor was on the right side, you would go back to the prostatectomy slides that were on the right side, you would review them and submit the whole prostate in this case, the whole side, and you recheck on that same side. Still, if you have no tumor, look for high grade PIN or IDC, intraductal carcinoma, or high grade prostatic intraepithelial neoplasm. So, in this case, when you check for these, you might see them, which might indicate that the tumor was totally removed. And these are clues that there was a tumor nearby that was biopsied and taken completely with the biopsy. Final step, if still there is no tumor, you would do recuts, you would do deepers, consume the tissue, and even flip the tissue and re-embed it, trying to find out any tumor that is there. So I'll leave you with these steps. They are useful to in practice or to answer such a question in the exams.